And this is an example of where an American Muslim can make a difference not just locally, but also nationally.
As physicians, we should never say, there is nothing else we can do for you. There is always something that we can do for them.
It's for the sake of Allah, to benefit humanity. First and foremost, the intention has to be to benefit humanity.
And we're very honored to have IMANA, the Islamic Medical Association of North America, as a key sponsor of our organization, and it's fitting that on the 50th anniversary of MSA that we're also celebrating the long-standing relationship between IMANA and MSA that spans many decades.
I just came from the IMANA Student Health Resident Forum, and IMANA did a great job.
Based on the sessions that we've had today, that we will have tomorrow, you will notice that we're focusing a lot on things that is being discussed even in general medicine right now, and that is on ethics.
I think today's session with the doctors and chaplains went really well. I really like the fact that they are including chaplains in recognizing the fact that chaplains are now on the team of doctors.
In sitting down and working with ISNA earlier this year, coming up with ideas and topics, we really look for ideas that actually span not only people in medical fields themselves, but for people who deal with day-to-day life, social work, community leading activities, as well as pastoral care.
We had the audience think out loud about what issues might come up when a Muslim family maybe is partially something else, partially Hindu, partially Muslim, partially Christian.
Bringing relationships between different faiths and medicine together.
You go to places like Haiti and you see people with defects like this. People who don't get treated. So you don't get to see that type of pathology in America.
Last year we did 200 surgeries in 5.5 days on the below.
We want to take our skill set here and take it there and give other people what we have over here. When you go on these relief trips, you're challenged. You're challenged and you're forced to do things that you may not feel comfortable with, but it sort of helps you grow as a physician and as a person.
Since Islamic bioethics is such a multidisciplinary field, with all of these fields feeding into this thing called Islamic bioethics.
I just attended one of the IMANA sessions on Islamic bioethics. I thought the session was great. IMANA has been helpful for me in my work as a chaplain because I get often asked about Muslims and end-of-life care and things like that and Islamic ethics. So I will often refer the staff at the hospital where I work to IMANA's website.
We actually have a IMANA hospice and palliative care hotline. It is a health fair that we've set up specifically for your blood pressure, diabetes. If you know people around in your family and others who are not necessarily in the health profession, please stop by so we can check your blood sugar.
There's free clinics all across America, and they're opening up even further. There's some in Detroit, there's some in Los Angeles, Homer Clinic, there's the clinics in Ohio State University and down in Florida as well. In fact, IMANA has helped develop the guidelines to develop such clinics. You can look this up on our website.
This was a session about establishing free health clinics in various parts of the United States. It was a very informative session. There are people here from Texas and from other states who were talking about their experiences of running a free clinic and what are the risks and benefits involved with it. I attended it because I wanted to hear their views and their feedback, and I'm glad that I did. It was a very good educational experience.
The business plans for those, or the articles of incorporation, or the bylaws for those, or the grants that have been written for those are available for others to look at.
As president, I think all of you know that the president is just sort of the face hitter of the organization. It's all of you that really make this organization move forward. Without your hard work, we wouldn't be where we are today.